Welcome to Developing Effective Abstracts and Posters. I am Corrine Jurgens, the Chair of the Nursing Committee of the Heart Failure Society of America. Kristen Sethares and I developed this webinar to assist nurses and others in submitting abstracts and posters to scientific meetings. This webinar is supported by the Heart Failure Society of America and the American Association of Heart Failure Nurses. Communicating your scholarship is the purpose of abstracts and posters. The gentlemen in this picture are certainly communicating, but I question the true effectiveness of their message. Abstracts describe your work from the beginning to the end, otherwise known as from the background, or why you did what you did, to the conclusion. The format varies between scientific and professional organizations, as well as between journals. However, the content generally includes the background, purpose, methods, results, and conclusions. Abstracts describe your work from the beginning to the end, otherwise known as from the background, or why you did what you did, to the conclusion. The format varies between scientific and professional organizations, as well as between journals. However, the content generally includes the background, purpose, methods, results, and conclusions. Abstracts describe your work from the beginning to the end, otherwise known as from the background, or why you did what you did, to the conclusion. The format varies between scientific and professional organizations, as well as between journals. However, the content generally includes the background, purpose, methods, results, and conclusions. Getting the attention of the reader is important, particularly for abstracts submitted to peer review. Reviewers are reading numerous submissions, and you want your work to stand out. Some tricks of the trade include putting the findings in the title. Alternatively, you may want to ask a provocative question. Reviewing published abstract titles will familiarize you with the various styles of titles and help you to select which style is most appealing and appropriate for your work. Another tactic is to move the important part of your work to the beginning of each sentence. In other words, putting the answer, key point, or conclusion first, or before where you would typically put the information after the therefore part of your sentence. Abstract word counts are almost always limited and range from 150 to 350 words. One of the more common errors for new writers is to use up the word count in the background. Investigators and clinicians want to know how and what you did, so save the bulk of your word count for methods and results. Use tables and figures judiciously, as tables and figures use a lot of word count. Word counts are tricky. It is better to write everything you want in the abstract first, and then follow that with editing to the word count. If you write to the word count in the beginning, the flow of ideas may be compromised. The background is where you briefly introduce your problem, and you should limit this to 2 or 3 sentences. You want to include the most relevant versus general background. For example, you might want to say signs and symptoms of congestion are the most frequent cause for hospitalization for acute decompensated heart failure, versus starting off with a general statement about the incidence and prevalence of heart failure in Americans. You also want to describe the gap in knowledge. For example, how completely congestion is relieved during hospitalization is unknown. This sets the stage for your purpose statement. Some people use a purpose statement or a hypothesis in this section, but it is one very direct and dense sentence. 2 examples are as follows. The purpose of this study is to describe a thorough process evaluation of an exercise counseling intervention in an ethnic minority sample with heart failure. Alternatively, a hypothesis would be stated, measures of quality care such as weight loss, heart failure teaching, and care by a heart failure specialist are associated with a lower rate of 30-day readmission and mortality. Both of these examples were taken from the last session of the Heart Failure Society meeting in 2013. So these were successful abstracts that were submitted and presented at that meeting. The methods section, of course, is where you're going to describe the actual design of the study or your project, and generally includes the population that you studied, how the population was sampled, the intervention, and the type of measurement. Again, you want to convey what it is you did in your work, and so a great amount of detail and word count is reserved for both methods and results. Now, there are different types of research, which is going to change the content of the methods section. Here is a qualitative example. We conducted semi-structured interviews with 24 mechanical circulatory support patients, 12 with bridge to transplant and 12 as destination therapy, both early and later after implant. Interviews lasted 30 to 60 minutes, were audio recorded and transcribed verbatim. Using qualitative methodology, data were analyzed using a two-phase coding strategy. Contrast that with methods for a quantitative abstract. Confirmatory factor analysis of the heart failure somatic perception scale was conducted in a convenient sample of 366 patients with chronic heart failure. Convergent validity was examined using the physical limitation subscale of the Kansas City Cardiomyopathy Questionnaire. Divergent validity was examined using the Self-Care of Heart Failure Index, Self-Care Management Score. 1-year survival based on the heart failure somatic perception scale scores was quantified using Cox regression, controlling for the Seattle heart failure model scores to account for variation in symptom burden, secondary to clinical status, therapeutics, and lab values. So you can see the population, the measurement, the sampling was all contained in this brief paragraph, but there is a lot more word count than you would see in background. The results section is where you're going to put your most compelling results. You want the relevant data, including the primary outcome and any key secondary outcomes. You want to include some relevant statistics as opposed to some general broad statements. The reviewers really want to see the strength and rigor of your work. You can use tables and figures when words are inadequate, but again, these use large amounts of word count, so be very careful about using them when you're preparing your abstract. Here's an example of a results section. You can see that we've got the sample was 61% male, 84% Caucasian, 60% functionally compromised with a New York Heart Association class of 3 to 4 and a mean age of 57, standard deviation 13.3 years. Internal consistency of the heart failure somatic perception scale had an alpha of 0.90. Convergent validity and divergent validity were supported, and we've reported some correlations and p-values or significance. Controlling for the Seattle heart failure scores, the heart failure somatic perception scale was a significant predictor of 1-year survival, with those most symptomatic having the worst survival. And this is followed by hazard ratios, confidence intervals, and again, p-values within parentheses. So we've really given a snapshot of the sample, the metrics that we used, and we've interpreted the data and then supported it with the actual statistics. Here is an example of a conclusion where you want to illustrate how your work made a realistic difference in practice or furthered knowledge. You do not want to say in this section that more research is needed, as every research study creates more questions that can be answered, so you can leave that part out. An example of conclusion that puts your work into the context of what is known is as follows. Perception of heart failure symptom burden as measured by the heart failure somatic perception scale is a significant predictor of survival, contributing additional prognostic value over and above objective Seattle heart failure risk model scores. This analysis suggests that assessment of a full range of heart failure symptoms may be useful in evaluating therapeutic outcomes and predicting survival. The following slide is just an example of an abstract that was submitted to a nursing science meeting last spring. And what I want you to take away from this is just looking at the entire abstract, you can see that the background is only 2 sentences. The bulk of the word count is in method and results. And again, the conclusions are just a brief summary of how this informs practice or research. Posters are just one way to communicate your science. Some meetings have posters almost exclusively as a way to present the research, and others have a mixture of oral presentations and poster presentations. So we're going to go through the basics of developing your poster, and then we're going to critique several drafts of posters that either I've presented in the past or some of my colleagues have. Poster developments, again, begin with a strong abstract. It's a good idea to review abstracts that were accepted to prior meetings so that you can see which abstracts were scored high enough that they were accepted for presentation. It's also important to seek peer review of your abstract prior to submission, and I encourage people to show their abstract to people who know the content area and also to people who don't. The people that know your content area will come in with one lens, but they may fill in the blanks with their own knowledge, whereas the people who do not know your content area will be reading it with a very fresh eye, and anything that's not clear, they're sure to question you about. Abstract and poster guidelines are going to vary from group to group, and you must adhere to what the guidelines are as far as size and positioning. Quite often, the posters are 4 by 6 feet as far as size, but others are 3 by 4 and they're vertical instead of horizontal, so you really need to know what the guidelines are before you construct these posters and, of course, get them printed. It's a good idea to identify resources for funding these posters. They can be done inexpensively through some of the web services that are available. You can do a search on that. But sometimes they can be quite pricey. So if your institution will support printing, you'd want to investigate that before you go ahead with ordering your poster. You have, again, another opportunity to get review of your poster once it has been constructed. You'll get a draft of your poster from wherever you send it to be constructed, and you want to have people look at it for clarity, presentation, and eye appeal as well. Some of the tricks of the trade are to make sure that you use a readable font. Arial font is a lot easier for readers than the Times New Roman. You also want to make sure that the font is large enough that you're able to read the poster standing at least 6 feet away. It's a good idea to examine your narratives and remove any extra words. The word "the," for example, is often one that can be deleted. It is not necessary to put in periods and colons and underlining. These kind of punctuation marks make your poster look very busy, and you're looking for a very clean look. So think about deleting those. And then it's important also to think about figures and graphics that are going to enhance what your narrative is in a way that might be done more appropriately with a figure or something. So that's something you can play with. Then you want to think about who your audience is. Is it going to be an interdisciplinary group where your acronyms might be unfamiliar to them? Or is everybody attending the meeting of similar background and you can use, save some of your space by using the acronyms? You also want to think about what your message is. Are you looking to network? Are you looking for a new employment position? Are you looking to discuss your science? And then what is the key point from your work that you will be able to highlight when somebody comes up and wants to get more information? You're going to use the format and design of your poster to highlight these messages and key points. When you do construct your poster, it's important to edit the text mercilessly so that your message is very, very clear. Again, proofing your work and having others proof it too is important. We tend to somehow not see our own errors, spelling errors, that kind of thing. So having a fresh eye is good. Whenever possible, you can use figures to do the talking for you, particularly if they lead you through the poster when you're presenting it. Photographs are very appropriate. And then again, practice, practice, practice for making sure that your message is very, very clear. We use the elevator speech to make sure that you're prepared to get your message out there. And basically what this translates to is, if you were in an elevator and you had to make a point with somebody, could you do it in the short time you were on the elevator going to wherever you were going? One of the things you need to do is think about having your punchline come first. So instead of giving a lot of details and saying therefore, and then giving your most important point, you want to have that point come first. So if you want to talk about diversity among nursing students as being important, you want to say that first and then provide support after the therefore. It's important to have your message easy to understand, so you want to avoid using jargon. Every discipline has their own language. However, if you're at an interdisciplinary meeting, people may be unfamiliar with the common terms that you use in your day-to-day work life. So avoid using jargon. You want your elevator speech to be concise. You know, it is important to do this research because make sure you know what your one big point is and be ready to sum it up so that they know the most important take-home message before they leave to go on to the next poster. There has been a lot of discussion in the groups that I've attended about what actually goes into a poster, and it's my view that a poster is a poster. It is not a mini paper, so you cannot put all of the information that you would put into an oral presentation or a manuscript into a poster. A poster is about creating dialogue, and the way you do this is you highlight your findings, you make the poster accessible to everyone so that you can demonstrate your skills. It is also appropriate to credit the institution and funding sources, so use logos as appropriate and make sure that they're large enough that the institutions and funding sources that supported you can be easily seen. And again, because this is all about a dialogue, you want to have a way for people to get a hold of you after the meeting. And the best way is usually leaving an email trail. You can have your business cards available, as well as mock-ups of your poster. A lot of people really like to take home a picture of what they discussed with you. And if you can afford it and you can manage to carry them to the meeting, it's a great way to keep your information ready, and accessible. Using some of my posters under construction and those of some colleagues, we're going to go through the good, the bad, and the ugly, and the importance of using drafts and peer review to improve the clarity of your posters. Here's our first example, and the first draft of this particular poster has a nice descriptive title of Designing Disease Management Programs for Hispanics with Heart Failure. I think the title is very clear. I would probably make that title a little bit larger so that you can see it from 6 feet away. The mock-ups of these posters are, of course, limited given the presentation method. They are usually 4 feet by 6 feet, so they are a lot larger than what you can see here, but you'll get the general idea. The other thing about this poster is there's quite a bit of narrative material in it. I would probably cut that down to make it so that there would be fewer words, but retain the meaning of the information that you wanted to provide. I would change the font in the body of the poster to Arial or something other than Times New Roman for clarity. There is quite a bit of narrative here and only one table. I might want to include a graphic that could illustrate the data a little bit more. But otherwise, you certainly can see the flow of what was done and the implications and limitations. I would put the implications over the limitations as well, but again, that's an artistic choice of whoever the author is. Now here's another first draft. This was one of my posters. And basically, we create PowerPoints and then we send them up to media and they create the posters. On this one, you can see that the method was a paste problem, as I call it. The artist hit paste twice, so I've got method in there twice. That's got to be moved. The color, I think, was a little distressing. It really doesn't go with the colors for the university, which is red, green, and blue. So it's kind of this pink color that had to be changed. I would change the font again from Times New Roman to something a little bit easier to read. I think the title is clear and large. The graphics are pretty good. I would probably enlarge the model descriptor figure. And you look over in the fourth column, there's some unusual white space that could be attended to. So you really want to look at the overall presentation of the poster, look for obvious errors such as the two method sections, and make sure that your figures and your fonts are clear and can stand alone. This is a redo of that same poster. You can see that a lot of the items that we talked about were attended to. Under the method, I would center that symptom cluster graph and probably make those, the descriptors a little bit larger. Overall, a big improvement in the second draft, but still in need of some work. Now, here's one that was primarily done with figures. And this, basically, you have to think of your poster as a prop. So I found it easier to talk off of this poster by just putting the graphs of instead of having the statistics, I put in the figures representing the statistics so that I could talk with any interested people about my findings. Another interesting thing about this poster is on the right-hand side, under the summary of results, we had the logo for the university. The logo has since changed, but the importance of having this logo behind my results and conclusion is that people came across the room because they saw the logo of the university and they were familiar with it. So using some of that kind of artistic license to get attention to your poster is always benefit. This is a poster of a colleague who was conducting a trial on oral care of elders, and the acronym was the PONY trial. She's got a photograph of a horse that you can see is the outline behind the narrative, and I think this is probably one of the most interesting and visually pleasing posters that I've seen. That's actually her horse, by the way, that she took a photograph of and then muted it so that she could lay her narrative over this photograph. It did bring people across the room to speak with her. She also critiqued her own work as far as how much narrative was in the poster and possibly could improve by decreasing the narrative, increasing the size of the font. But overall, this is a really interesting and effective poster, and she had a lot of discussion at the meetings that we were at. This particular poster has most of the information, or the most important information, centered right in the middle. You can see under DNP scholarship, transformative learning, and distance education, there's a model about the process that we went through as far as creating this curriculum. And in art circles, this is known as the golden rectangle. And I am not an art person per se. However, I have shown this poster to people who are, and this is the poster that the artists like the best because of the visual being in the middle. So that's one way to consider organizing your work. You still go from background to results is underneath, and then the analysis and implications is on the right-hand side. So you can have some creative processes with that. But think about how you set up your poster and what's going to attract the eye of the people walking by. Again, you have about 15 or 20 seconds to get people to come over to talk to you. And you need to be able to be ready to engage them And one way to do that is when they come over, say, you can ask them whether they're interested in the topic area, or you could start off with the most interesting finding we had was, and that could start the conversation. Again, posters are all about dialogue, and you want to be prepared to initiate. Don't just stand there letting people read your poster. You want to interact with the people that are coming to see you. Okay, so we have some opportunities for mentoring, both with the Heart Failure Society of America and the American Association of Heart Failure Nurses. If you wish to be matched with a mentor, the contact information is below. You simply need to send us an email, write mentor request in the subject line of the email, and we will pair you up with somebody to review your work, both the abstract and the poster, or just the abstract for these meetings. You should also be aware that there are several websites that provide poster construction services. You can just do a search and then select them, but they will put together your posters, send you a draft, print it, and mail it to you if you don't have those resources at your institution. So final thoughts. Poster formats vary dramatically between organizations and meetings. So you need to carefully look at how your poster is going to be presented. They will tell you the size. They will tell you how it's going to be mounted, whether it's a tabletop, which is another whole thing with getting your poster work onto something that's going to stand up by itself. Often they do have bulletin board-like equipment for you, but you might have to bring your own push pins. And some meetings now, you submit them electronically, and that's really a very nice way to go, but it's not as common as the mounted ones where you're going there with your poster wrapped in a tube and mounting it yourself. Some groups like having references from your work on the bottom right-hand corner of your poster. I'm from the school that references take a lot of your space on a poster, so I would rather have a handout with those if you think they're really important. But again, that's really going to vary by professional organization, so you should get familiar with where you're presenting and what kind of posters you generally were going to be seeing. You want to think about the presentation of your work, so you want to think about color, white space, and logos. You want to use a very large font for your title and avoid large white spaces. Make sure that you credit your institutions and funding bodies. Again, as I said before, you want to start the conversation with attendees. One trick is the most interesting finding was, or do you have an interest in, and really get people to discuss your work. It's a lot of fun. It's great for networking, and you really want to keep the conversation going after the meeting. So that is our presentation. Again, if you would like some mentorship, use the email addresses on the prior slide, and we look forward to seeing your work. Thanks very much for your attention.